Hello, this is Anil Guri from Fertility Plus in London, and today we're going to talk about one of the most frustrating and the worrying problems that many young women and their clinicians face when periods stop because of stress, weight loss, or heavy exercise, or most importantly, when and how they come back. The condition we are discussing is called functional hypothalamic amenorrhea, or FSH. FHA. In FHA, the brain decides that the environment isn't safe for reproduction. It turns down the hormones that drive the ovary and stops the period, even though scans and blood tests show a structurally normal reproductive organs. FSA is common. It accounts for about a third of all cases of secondary amenorrhea where periods stop and is seen in almost 89% of women with anorexia, that is eating disorders, and up to 60% in high level athletes. Very commonly seen. So, if you have an athlete who comes as your patient, that's one of the commonest things that you see. A large review has pulled together 49 human studies and mechanistic work from animal models to ask three simple questions. If, when, and why do periods come back after FHA? The authors looked at women with eating disorders, athletes, and stress related FHA, and they examined body weight, body fat, energy intake, and expenditure, hormones, and other psychological factors. Several important patterns emerged. For women recovering from eating disorders, periods usually return once weight and body fat have improved. Many studies report recovery around BMI of 19 to 20 and body fat between 18 and 28%, often at about 91 to 95% of the expected body weight and roughly 2 kilograms above the weight where the periods were lost. That's important. 2 kilograms, just about when the periods were lost. But here's a catch. The timing is unpredictable. Some women menstruate within a couple of months reaching their target weight. Others take a year or two, and around 5 to 14% remain without periods for long term despite normal weight. In athletes, the focus shifts from the scale of energy availability, how many calories are left after training, when that drops below 30 kilocalories per kilogram of lean body mass per day, the pulse of luteinizing hormone becomes abnormal and cycles often stop. Increasing caloric intake, reducing training load, or both can restore menses in most athletes in small studies. Though, again, time course varies from weeks to many months. The review also reminds us that not just about food and exercise, hormones such as leptin, insulin, ghrelin, cortisol carry messages from the energy and stress to the brain. High cortisol and ongoing psychological stress, especially perfectionism, trauma and mood disorders, strong influence, where the periods return, cognitive behavioral therapy that targets these patterns has been linked to normalization of cortisol, leptin, and to menstrual recovery. What about medication? Estrogen replacement is important for bone and cardiovascular health, but it doesn't reliably jumpstart natural cycles. Early studies of leptin treatment and naltrexone, an opioid antagonist, are promising. One trial of naltrexone reported 80% of women resuming menses within 90 days, but that evidence was limited. The core message for both professionals and patients is that FHA is usually reversible. There is no magic number, no guaranteed timeline. The best strategy today is a holistic one: restoring adequate nutrition and body fat, correcting energy deficits in training, and addressing stress and mental health, ideally a coordinated team. At the same time, we need better long term studies to help us give women clear answers about what they can expect their cycles and the fertility return. So, what is the bottom? If you have irregular periods or no periods, if you're an athlete, if you're having eating disorders, then you're more likely to have something known as FHA. And in those cases, regaining weight, taking specialist advice may be important.